David Staples here from the Edmonton Journal. I'm here with Dave Breckenridge, managing editor of the Journal. Welcome, Dave.
Thanks, Dave.
Today we're going to do the top 10 tweets from Alberta and around the world on day 38 of the global coronavirus pandemic. 38 days, Dave. It's been a long, long time. Seems like forever.
True story. I haven't left my basement in 5 weeks. No, I'm kidding. I've gone upstairs. I've gone outside.
Did you cut your own hair?
I did. I feel like I'm due for another haircut. I did the sides and the back. I need to deal with the top, but.
All right, Dave, why don't you kick it off? What's your first tweet?
My first tweet is it's one that kind of stuck with me just because maybe she's looking at the past through rose-colored glasses. But it's New York Times reporter Maggie Haberman, at Maggie NYT. There's a link, but the tweet itself is: the U.S. was galvanized into unity after the Great Depression, Pearl Harbor, and the launch of Sputnik. COVID-19, by contrast, is spurring a hunt for scapegoats. The virus is only worsening America's divide. I think there is a lot of that. If you look at social media, there's a lot of division. Even some of the tweets you selected in your collection of tweets at edmontonjournal.com. You know, there's one guy who compares, who says America is a bunch of babies now because they fought a war during a smallpox outbreak that killed 33% of infected people or something like that. There is a lot of division about how the U.S. is handling this. I think that is very stark.
I think it's a pretty divided world right now.
Yeah.
It's hard to speak to the past, although because we weren't there. And, you know, we can remember.
I wasn't there for any of it.
Yeah, well, we were there for 9/11, like how the world, there was a coming together in the West.
Yeah.
I think after 9/11.
Yeah, that's true. America was galvanized and the West was galvanized. Yeah.
A little different kind of event, where, I mean, there's a clear enemy here, but the enemy is a mindless, unthinking virus. So, but I would say this: having read Pierre Burton's book on the debates around the National Railway, the Golden Spike, the viciousness of the partisan attacks at that time pale. Well, they don't pale. They are very similar to now. And I think at different times, and I think it often comes down to a media model. Is there a ton of competing media voices, or is there just a few, like we had in this, from the 1950s to 2000, just these few newspapers, few TV stations? If you have all these competing media voices, they have a tendency to fragment along political lines. And I would say you had that in the late 19th century, like in the 19th century when those debates were going on with MacDonald and in the 1870s, 1880s. All of that was a very, very partisan, fragmented time. And so this isn't the first time this has happened, but I think it is happening right now.
Yeah.
My first tweet comes from NBC News White House correspondent Jeff Bennett, and he's looking at what's happening in Germany now. And his tweet is, quote, "Germany is set to reopen small businesses next week and schools on May 4th. Here's why. Germany has a comprehensive testing system that allows officials to identify and isolate the infected at an early stage. It has the capacity to run 650,000 tests a week." So this is, Germany actually has more deaths per million, 3 times as many deaths per million right now as, or overall, as Alberta has. But Germany, I think, is at a slightly different part of their peak. The key comes down, and there's a must-watch video, which I've linked to in the post, where Angela Merkel, I think that's how you pronounce her name, the Chancellor of Germany, talks about the science of reopening. And one of the things everyone says we have to make a science-based decision on reopening. I think that makes sense. But what are then the scientific metrics which will guide us in terms of making this decision? That's what I've been keen to find out this whole time. If we're going to make a decision on science, okay, what is the science? And so Dr. Hinshaw has talked about, the capacity of the healthcare system to manage the outbreak. And I think I agree with her. That's key. And she's talked about, the number of ICU beds and hospitalizations we have and the rate of new admissions. And in Alberta, we're just trying to get our heads around that. In her video, Merkel talks about the infection rate and how if you have an infection rate of if it's 1.0, then you're okay. That's flat. But if it gets to 1.1, she was saying that their healthcare system is overwhelmed in 2 or 3 months. And if it's 1.2, then it's overwhelmed quicker than that. So the quicker the infection spread, and it just has to go up a little bit, the quicker the healthcare system's overwhelmed. So that's something else to keep an eye on here in Alberta is the infection rate. And so I'll probably get a chance to ask Dr. Hinshaw about that and to find out what our infection rate is right now in Alberta. If we know that, we may not even know it yet.
Yeah, that was a good video by Angela Merkel. That I think that summed it up, and it's she was fairly reasoned and it fairly easy to understand that you're right that even if it goes up that 20%, it can be chaos.
Yeah,
and we don't want chaos.
No.
So for my next tweet, it's a little on the lighter side. It's from someone named Shannon Says at Shanadelic. My daughter came to visit. We shouted at each other, me on the front steps and her on the driveway, with a couple of smiley crying emojis with hashtag isolation life. My mom came by my house to visit yesterday. She sat in her car and we stood on the sidewalk so she could see my kids, her grandkids. My sister has stopped by last week. Same thing. I think it's one of those things that it's good to do, that, that face-to-face interaction is important. Just a feeling of that connection that you may not get by a phone call or a text or a Facebook message or a tweet. That I think is everyone's kind of lifeline in the middle of all this.
Yeah, I got together on Skype here with 5 of my high school friends last week.
Nice.
And that was fantastic. It just felt so great to see their faces and talk to them.
Mm-hmm.
This is from my next tweet is from retired CTV reporter Alan Fryer with a link to a National Post story, which he quotes from. And the quote is, Guy Saint-Jacques, who served as Canada's envoy to China from 2012 to 2016, said China's leaders in Canada and elsewhere need to call for a full investigation of the WHO after it uncritically relayed information from Beijing.
Mm-hmm.
So the WHO obviously is on the hot seat from almost every country on earth right now, except notably Canada, from the Prime Minister at least. But the opposition, of course, is after the WHO. So this is going to be a very interesting time for this international organization. I personally think that they needed to be in Asia. What we saw when China was releasing its information, all the countries who know China best and are right next door, they didn't trust anything out of China, and they immediately put up really strict restrictions. And they treated this like the outbreak that everyone knew in China that it was, and all those countries knew. The WHO rather uncritically accepted, I think, as this former diplomat is saying, they were too uncritical in terms of their response to China. Probably in it, they were probably trying to give them a defense. They were probably trying to remain on good terms with China. Nonetheless,
so they could get inspectors, so they could get
Correct.
staff in and try and figure out what had happened, right?
But that was in the interest of the WHO. Now they may conflate that with the interest of world public health, but really the world needed to hear from the WHO, I think, early on. We need a mandatory quarantine on travelers out of China and out of Wuhan, and we didn't hear that from them, and they're going to hear about it because they didn't do that.
Yeah, and I mean, tied to this, and it was interesting. HBO host Bill Maher was talking about some of this stuff around China and whether you can trust China, and then there's that middle ground of being reasonable in dealing with threats like this from China and the failings of the Chinese regime, and then not making that as an excuse for racists. My next tweet deals with this. It's California lawyer Christine Pelosi at SF Pelosi. All you racists out there blaming Chinese Americans for the coronavirus should know that according to the San Francisco Department of Health tracker, there are very few cases of COVID-19 in Chinatown, despite many, many cases of viral racism on Twitter. And this has been something that's been going on for a while. Like, can you talk about China and its culpability here or its failings to properly report to the international community the extent of the virus without being racist. And yes, you very well can. And calling out the Chinese government is not the same as calling out Chinese people, nor should it be. And it's not an excuse for people to discriminate or be racist in any way against Chinese Americans, Chinese Canadians, the Chinese people.
I think people have a lot of sympathy. I mean, for the Chinese people. I mean, they're living under a totalitarian regime. The level of prosperity there has increased because they took on some, business capitalist measures to get their economy going. But I think a lot of, I think that early on, Tam and Hinshaw were both addressed the racism in Canada against the Asian Canadian community, and I think they were both obviously correct to do so. The problem was that Tam then conflated that with travel policy from an infected area. Travel policy from an infected area, whether it's from China or England or the United States, that's a separate issue than the need for Canadians not to be racist. And she got the two mixed up together in her head. And that was a mistake that she made when she did that. My next tweet comes from, we've already kind of talked about this. This comes from Poker Life podcast host Joey Ingram. And he says, quote, "It's so easy to get depressed when you isolate yourself inside and don't see anyone else. I've lived this way for about a year. Make sure to stay connected with others by voice, not just text, and try to get out of the house to move around." And couldn't agree more with this. The few times when I felt like, usually I'm just sitting in front of my computer working this whole time, but the few times when I've felt like the world is still a good place and I've been happy and healthy is when I've gone out for long walks, usually late at night, because then there's no joggers or cyclists.
Yeah.
To be running, it's funny. This is just as an aside, like Dr. Hinshaw has spoken out against golfing. I mean, I don't care about some golfers all on their own on the golf course, but when a cyclist charges by me on his bike, breathing heavily, that gets me a little worked up. But yeah, getting out for a walk and doing that kind of contact with other people is really healthy and really good.
Yeah. The Maldives Health Protection Agency, relating to family. Many of us have older family members who are at risk for COVID-19. Do not put their lives in danger by meeting with people outside of your household. Anyone can get it. Anyone can spread it. And I mean, you talk about the need for being social, but we want to make sure that we're keeping our elderly relatives safe. I know that here in Canada and Alberta, they've kind of clamped down on who can go visit whom. And it's just a reminder that you may not want to go be too close with your family members.
My final one is from U.S. right-wing commentator Bill Mitchell, and I think I'm including him because when I look for the tweets that are getting the most action on Twitter, and Mitchell's tweets from a certain segment of the U.S. population are incredibly popular. And he initially was one of the people saying, well, this is no worse than the flu, let's not overplay this. And that's been his position from the start. And there's a faction of the population that believes that. So he represents this faction. And his quote is, "We fought the Revolutionary War during a smallpox epidemic with a 33% mortality rate, which makes COVID-19 look like a mild summer cold. When did we become a nation of babies? This whole lockdown business is so un-American." And it's hard to talk like, to bring, there's a lot packed into that tweet. I mean, I don't actually know what the mortality rate was. I don't trust his history about that, but maybe I'm wrong about the mortality rate with smallpox. But this whole downplaying of COVID-19 came before people knew how it was always crazy because it came before people even knew what the mortality rate was going to be. We still aren't sure about it, but we know that if you don't get on top of it, your healthcare system crumbles. We've seen that in a number of countries. So for people to be in denial that this is at least a very deadly and dangerous virus. I don't know. Like, I don't know what world what planet they're living on.
I get it. I understand what I don't agree with it. Don't get me wrong, but I get, like, he's trying to make a point that, that we shouldn't shut down our country. America didn't shut down in the Revolutionary War because of smallpox. And I kind of laugh. I think that had American society been what it is now, and American health system was what it is now, and you can debate whether the American health system is great, but if today's conditions were in place during the smallpox outbreak during the Revolutionary War, you would assume that George Washington would have shut things down and said, whoa, we gotta keep people safe. We've got to keep people spread apart while still trying to fight a conflict. Like, it's kind of ridiculous to compare the two things. It doesn't hold a lot of water. It's
hard to talk about it because it's kind of so preposterous. But, I wonder what the wealth, like, we place a lot more value on human life than they did in the 1700s. And one of the reasons they fought that war was to put more value on life, like to give everyone the right to what formerly rich people had only had, the pursuit of happiness and wealth and prosperity. Well, now we're there. And so we're all acting like the richer people probably did at the time. And I bet you the very wealthy people in the 1700s certainly tried to isolate themselves from the smallpox and take every precaution possible. Sane people have always done that. So we are acting exactly like the wealthiest and smartest and most privileged people did at that time. Now that privilege has been extended to hundreds of millions of people around the globe. And you better believe that we're going to try to keep ourselves safe and away from this virus. So it's just nuts what he's saying. And but on the other hand, I write in my column today, like, okay, there's an economic calamity at hand that is going to cause a lot of despair. And we do have to get our heads around, okay, what is it going to take? Because this virus isn't going to go away. It's here for a couple of years. It's going to come in wave after wave, hopefully smaller waves. But we've got to learn what are the metrics that we're going to look at that will keep us going. How much can we withstand of this virus? Because it's a matter of coexistence, I think, at this point. We're not going to be rubbing it out. So we have to figure out how can we keep things going while coexisting with the virus?
Well, I mean, on the flip side, had COVID-19 been the virus that they were dealing with during the Revolutionary War, the mortality rate probably would have been much higher than it is now, just due to the fact that
could be as well.
There wasn't much of a healthcare system around back then either. Anyway, my last one, kind of going back to the debate around China and how to approach dealing with the Chinese regime, and whether or not it's being helpful or open or as transparent as people wanted it to be. This is Globe Mail reporter Marique Walsh. I apologize, Marique, if I mispronounced that. Trudeau didn't mention China in any of his responses to questions on China, but he did link his approach to the procedure. Sorry, but he did link his approach to the need, the procedure, personal. I'm going to start that again.
Start it again, man.
Because I think there's a the instead of a to. Trudeau didn't mention China in any of his responses to questions on China, but he did link his approach to the need to procure personal protective equipment, and much of that comes from China. I mean, it's true. If you need things from China, casting aspersions on the Chinese regime may not help you get those things that you need from China. At the same time, I think there's a lot of people in Canada who want to hear the Prime Minister and other political leaders call out blame where blame should be cast. And right now, a lot of people are getting the sense that there's a lot more blame that can be cast on China than there has been in the past. There was a story the other day in the Washington Post about a lab, the Wuhan virus lab, being
Wuhan
concerns about
Institute.
Institute of Virology. Thank you. And there were concerns in American diplomatic cables back to the U.S. that suggested there are concerns around security and protocol there, and maybe the virus came from a lab there. We don't know the source of the virus yet, but the idea that it was known about well before December 31st, that the government there was downplaying human-to-human transmission, and concerns over a lab that deals with these kind of viruses having lax protocols leads to some questions that need to be asked. And people want to see their political leaders at least point that out. But understandably, if you also need resources from that same regime, you may want to try and soft pedal your criticism.
I don't know what's going on with this. I mean, it brings back the whole thing of Trudeau, like before he was elected prime minister, like speaking his admiration for the Chinese system. Like he just seems to have a blind spot here, and it's making him frankly look ridiculous and look out of touch, because they muzzled the whistleblower. They've disappeared doctors, a doctor who has spoken out about it. They lied to the WHO. All of these things are now proven, and again, as you're saying, there's a report that the Wuhan Virology Institute had really unsound safety practices, and maybe there's a possibility this virus leaked out of there. Come on. You just speak, and it's making them look ridiculous, Dave. Dr. Tam yesterday was asked about this national stockpile, and why didn't you have enough equipment in the national stockpile? And an easy answer would have been, well, if China had told us the truth, we would have been stocking up earlier. We would have made sure we had more stuff. But because she was buying what China was selling, the federal government didn't get on to procuring stuff and even looking what we needed till mid-February. We had a late response because we bought China's line, and the WHO bought it, and we did whatever the WHO said. I guess maybe that's why they don't want to. Maybe that's why they don't want to admit it, because they don't want to admit that they took bad advice. Maybe that's it. I don't know.
Possibly, but I mean, it was only a few months ago, remember, that the world community was very outspoken in its criticism of the Chinese regime for its treatment of the Uyghur population. And it's like we've forgotten that they lied about having camps for these people that are, you could call concentration camps. They were lying to the world community about how people were being put in the camps, and then the numbers of how many people were in these camps and how many people had died in the camps. Like the idea that, we're putting all of some of these past suspicions about the regime aside now is just kind of crazy when you think about it, especially that the Uyghur issue was making international headlines a scant few months ago.
Yeah. I think that we have a capacity to understand that political leaders are going to make mistakes during these crises because the information is uncertain, the data is uncertain. And I just think it would be wise for them to point out one of the reasons that the data was uncertain at the start is because we now know China lied to us. We are offended by that, and we going forward, that's going to be on our minds as we make decisions that that we can put less faith in whatever China tells us. Just make a simple statement like that and move on. Because this is starting to be a big issue. It's starting to come up repeatedly at press conferences, and the guy just can't seem to get past it because I don't know, he's got a blind spot for China, as I say. Well, do you want to leave it there? All right. Thanks, Dave. Thanks for talking today. And thanks everybody for listening. Until next time.